What's going on, everybody? Welcome back to the SRT Therapy YouTube channel. So, have a lot of questions regarding what the difference is between chiropractic care, SRT therapy, and massage therapy, or other stretch therapists that are in the field. So, stretching companies or stretch therapists. So, stretch therapists, massage therapists, chiropractors, okay? Well, we're going to look into two main systems that the westernized approach looks at. Chiropractic care. First and foremost, the primary system for chiros is going to be your skeletal system, okay? That's what they work with. They work on manipulating, they work on their high velocity adjustments, they work on readjusting the bones of the body. That's your skeletal system. Now, massage therapists and most stretch therapists are looking at your muscular system. Fascia is a big trending keyword nowadays. So we have fascia stretch therapy, we have fascial system with muscular system. However, we do understand that every time you move the body, you're moving muscle. If you're moving muscle, you're also facilitating the movement of fascia. Okay, so two big components: chiros, skeletal system, stretch therapists, massage therapists. Typically, muscular system, deep tissue, trigger point release work in the muscles, okay? What SRT is yes, it's called soft stretch release techniques. It's also focused on the four primary systems, which is your nervous system, primary. That is our first system. So, one of the biggest differences is chiros do not consider the nervous system typically at all. Massage therapists, stretch therapists are not really focused on the nervous system. They allow their techniques to unwind or downregulate the nervous system. However, their focus, their primary focus, is usually the muscular system, okay? Now, with SRT, our primary focus is on your nervous system, then your fascial system, and your lymphatic system. So when we work with your nervous system, we are understanding that the peripheral nervous system, the PNS, is what your sensory input data collectors are, okay? So sight, touch, hearing, smell, and taste are downloading constantly 24/7 into your PNS, which goes to your CNS, which is that central nervous system up at the brain. Okay, so we know that your nervous system is intertwined heavily with your fascia, your muscles, and your organs. Okay, so by affecting and intentionally focusing on the nervous system, we are inadvertently and directly also affecting your muscular system. So if we can understand that every time we touch a body, every time we have an experience through touch, skin is the biggest organ on the body. It is the most sensitive when it comes to your sensory nervous system PNS components. So every time you touch somebody, you are installing new data. Does this feel safe? Does this feel good? Does this feel bad? Is it scary? Is it comfortable? Is it uncomfortable? Every single time you have somebody touch your body, not only are they touching you physically, but energetically, which is our fourth system, belief and energy systems. Energetically, they are transferring their energy and you are transferring your energy. So this is a huge component. It is the subtle difference between a stretch therapist and an SRT professional or specialist. It's the subtle difference, yet big difference, between a massage therapist and an SRT professional or specialist. It's intention and focused application of these four systems, okay? We're not intentionally or directly focusing on the skeletal or the muscular. We are focusing on these other highly neglected systems when it comes to the bodywork field. Your nervous system is going to be the biggest primary system that we want to address. So if it's skeletal, We know muscles connect to bones. We know muscles move the bones. If it's a skeletal issue, we know it's a muscular issue, okay? If it's a muscular issue, well, we know the nerves control the muscles. If you have nerve damage, you have muscular atrophy, okay? Your muscles will not grow no matter how much you try to move them or work them out. The muscles are controlled by the nervous system. So when we work intentionally with your nervous system, we can then work the secondary systems, muscular, skeletal, okay? So that is the biggest and most subtle difference between what SRT is, what an SRT professional and specialist will work with and understand versus your traditional stretch therapist or your massage therapist or your chiropractic, which we're not even in the same lane as chiropractic care. So just understanding that all of these modalities have a certain time and place and benefit for everybody. Not saying they don't. We're saying there are other systems, other approaches, other applications that can be considered for somebody who is not responding effectively to these other modalities. They may need something else. SRT might be exactly what that something else is. So thanks for watching, guys. I hope these videos help you understand a little bit more about our approach, our 4 systems that we work with, why we work with them, how we work with them, and how powerful soft touch, soft stretch, soft tissue work actually is.